Okay, so I'm Dr. Adelsheimer, and thank you for joining my webinar tonight. And I am going to start by sharing my screen and going on with my slide presentation. So get that up. Okay, so I'm Dr. Adelsheimer. The topic of tonight's webinar is how to reduce pain, avoid surgery. We're going to be talking about regenerative medicine and how we use your own platelets and stem cells to help treat orthopedic problems without surgery. Again, just to introduce myself, I'm Dr. Marc Adelsheimer. I'm a native of Pittsburgh. I went to Duke University, did my residency at the Medical College of Pennsylvania, did my internship and residency at Tufts University in Boston, and I've been practicing back in Pittsburgh, my hometown, since 1996. I'm board certified in physical medicine and rehabilitation, and in my spare time, I like to play a little bit of golf. This is our practice. These are my two partners, Dr. Paul Lieber and Dr. Jess Sally. Dr. Lieber and I have been together for close to 30 years now, and Dr. Sally joined our practice over 6 years ago. We see patients in various parts of Pittsburgh, but our main office is our Fox Chapel location, and that's where we do all of our procedures that I'm going to be talking about tonight. So in this webinar, I'm going to show you, number one, our three-step process for our stem cell procedures, where we get these cells, how they work, what they can help, and then importantly, I will answer all the questions that you may have at the end. This is a little agenda for tonight's talk. First, I'm going to begin with talking about Regenex, which is our partner, and we are Regenex Pittsburgh. I'm going to talk about different options. I'm going to talk about interventional orthopedics, and that's what we practice. I'm going to talk about the Regenex differences and why Regenex is very different than other people who do similar types of treatment. We're going to talk about who this is for and some of the results that you can expect. So first, let's talk about Regenex. Regenex is where orthopedic stem cells injections were invented. It was founded in 2005 by Dr. Centeno and Dr. Schultz, and it was the first clinic on earth to begin treating orthopedic conditions using precise stem cell injections. Dr. Centeno and Schultz started in Colorado, and they became very busy in Colorado, and they expanded, and we were actually one of the first groups that they expanded to back in 2012. So we've been part of Regenex since 2012. Now Regenex has grown significantly, and there's actually over 70 Regenex clinics to date, not just 65. Every Regenex provider is a doctor. They're either a MD or a DO. They've all been trained in the same way. So every Regenex provider has been to Colorado several times and is trained specifically by Dr. Centeno and Schultz and their partners in how to do prolotherapy, PRP, and stem cell injections. So whether you come to see us in Pittsburgh, Regenex Pittsburgh, or go to Regenex in Florida or New York or California, you're going to be getting similar treatments. So Regenex is not a product, but it's a family of medical procedures that we define as a new medical specialty, and that's what I'm going to talk about next, and that is interventional orthopedics. So what is the goal of interventional orthopedics? This is still treating the same orthopedic problems that you would see an orthopedic surgeon for, but our goal is to use less invasive procedures to avoid surgery. So everything we do is non-surgical. We don't use scalpels at all. Everything we do is done with a needle. We're letting the body heal itself. Surgical orthopedics will not be the dominant form of care for most of the 21st century. There has been multiple studies that shown that most people who had their meniscus, their knee meniscus surgery performed, 95% they're actually causing harm. They're removing a much needed spacer, and all this does is speed up the onset of arthritis. This is just one example of surgeries that are not indicated and actually cause problems. So instead of cutting things out, why don't we inject your own cells so we can help you to heal your own problem? This is a little timeline of orthopedics. And as you can see, in the year 2000, most things in orthopedics was done surgically. By 2015, this gap had been bridged a little bit, but the future of orthopedics is this. So by 2030, about 70% of what was done in 2000 with surgery will be done, will be able to be treated without surgery, with interventional orthopedics. And again, that's what we do in our practice. So interventional orthopedics is a system by which we deliver biologic agents, meaning your own cells, and we do this precisely, and this slide is showing that we use both X-ray and ultrasound guidance. This is actually a picture of the equipment that we use in order to perform these procedures. So whether we're using ultrasound to get into a tendon or X-ray to get into a joint or part of the spine, every procedure we do is very precisely aimed and guided. So we are 100% sure our needles are in the correct location. I'm going to show a couple of pictures of, here's a needle coming in and here's some dye going into a shoulder joint. It's not easy to stick a needle into the shoulder joint. And when a doctor does it blindly, meaning they just shove it in and say, yeah, I'm in, they don't really know that they're in. This is precise. So this is showing exactly the needle coming in here, and then down below is a little bit of contrast dye to confirm that that needle was directly into the correct location. Here's another example of a knee. And here's some pathology with the knee. Here's two different needles. One is going into the joint, and there's some fluid going in the joint. And the second one is going into the bone to help treat this bony lesion that you see on the MRI. So we compare the MRI, we make sure we're in the right location. And this is the example of the X-ray machine confirming that we are in the exact location where we place our needles. This is what it looks like under ultrasound. So here's a needle coming in, and we use this. So this is going around the median nerve of the carpal tunnel. Ultrasound is a great modality in getting to more superficial structures, such as tendons, such as nerves, such as ligaments. So again, we're using interventional orthopedics to do our treatments, and the treatments that we provide are regenerative medicine. Regenerative medicine include the treatments that are listed in this slide, which include prolotherapy, platelet-rich plasma, platelet lysate injections, and stem cell procedures, or same-day stem cell bone marrow concentrate injections. And I'm going to go over these in a lot more detail as we go forward. So what cells are we using to try to help to heal your own problem? The first cell we use are blood cells, and these are platelets. Platelets are found in blood. They contain the healing growth factors. They help speed up repair of tissues. Platelets also contain serotonin that helps to calm down pain, and they attract stem cells and help to activate them. So you'll see when I talk about a stem cell procedure, how we use platelets as part of that procedure. So we use platelets in our practice in two different ways. One is as PRP, or platelet-rich plasma, and also something called platelet lysate. You're still using your platelets, but we use them for different purposes depending on what we're treating. So PRP is best for treating joints, tendons, ligaments, and cartilage. PRP has become extremely common in the sports medicine community, especially due to the fact that it is great at treating tendon injuries. So people that present with rotator cuff tendonitis, lateral or medial epicondylitis, which are golfer's elbow or tennis elbow, Achilles tendonitis, medial meniscal injuries. All of these are common sports injuries that can be treated and cured with platelet-rich plasma. It has become mainstream in sports medicine. Just in the Pittsburgh area, a good example last season was when TJ Watt had an injury to his pectoral tendon, and he had a partial tear. He was treated with PRP, took a few weeks off, and was able to get back to playing full contact professional football. And this is an example of how PRP is used every day in the sports medicine arena. We also use platelet lysate, which is done when we're treating nerves. So what we're doing is we're using the same platelet, but we're treating that platelet to release all of its growth factors immediately. And when they release growth factors, it helps nerves to heal. So if we're doing an epidural injection, instead of putting cortisone or steroids into the epidural space, we put your own platelet lysate, which is, again, the healing enzymes that's going to help those nerves heal. Another example is treating carpal tunnel syndrome. We use a platelet lysate to help cure that problem as well. So things that may have required surgery, like carpal tunnel syndrome or a herniated disc, can very easily be treated without surgery by using your own platelets. The other thing that's very important that this slide shows is that the PRP, or the platelets that we get at Regenexx, is a significantly higher quality product than what you would get at your orthopedic surgeon's office. The reason being is we have much better equipment to help process the blood, so we don't have any red blood cells in our product. As you can see, the Regenexx PRP, or what we call super concentrated platelets on the right of the screen, is not bloody, whereas a standard PRP that you get from a bedside machine that orthopedic surgeons have in their office still has a lot of red cells in it. What's the difference? Red cells don't help to heal, and they hurt more. So if you get this done in an orthopedic surgeon's office, you are getting an inferior product. It will not help you as much. It will not be as high a concentration of platelets, and your chance of having as good of an outcome will not be nearly as high as if you were to get that at our practice. So the other cell that we use is a stem cell. And first I'm going to talk about what an adult stem cell is, and then I'm going to walk you through what a stem cell procedure looks like in our practice. So a stem cell is an undifferentiated cell that's held in reserve until it's needed to repair or replace tissues in various parts of the body. So we all have billions of stem cells in our body. Right now, they're living in our bone marrow or in our fat. And when we need these cells to help grow new tissue or to help heal or repair tissue, they're called upon and are sent through the bloodstream to the various areas of the body where they're needed. So the same stem cell can turn into many different cell types. And that's what's so exciting for us in orthopedics, meaning that we can use the same stem cell from your bone marrow to treat a torn ligament, to treat a bony necrosis, to treat an area that's lacking cartilage, to treat a torn tendon, meaning that same cell will grow into different tissues and help to repair all those different types of tissues. So stem cells orchestrate a repair response. They are like the construction workers. They're going in there and doing the work to help heal and to help repair damaged tissue. The other great thing about stem cells is they self-renew. So if you were to give stem cells for a stem cell procedure, your body will regrow all of the stem cells that we use, and it takes about 6 weeks for that to take place. So you can get another stem cell procedure with us generally anytime after 2 or 3 months from your first procedure. Also, stem cells do provide new blood supply in the area where they go, which can also help to lead in a healing and repair process. So what we're talking about at our practice are adult mesenchymal stem cells. Sorry, excuse me. These are autologous, meaning they are coming from you. They're not coming from somebody else. They're either bone marrow derived or adipose derived. However, we use only bone marrow in our practice. So next, I'm going to walk you through what to expect if you were to get a stem cell procedure. This is going off. So there's 3 steps to a stem cell procedure. The first step is done with prolotherapy. And what prolotherapy does is it, quote, tills the soil. Prolotherapy is a sugar water solution that we have on our shelf. So we don't need any blood or bone marrow from the patient. It starts a inflammatory reaction, so it basically primes the joint to get ready for a stem cell procedure, which is the next step. It's usually done anywhere from 2 to 5 days before a stem cell procedure. So the stem cell procedure is 2 parts. This is day 2. The first part is we need to get the stem cells, and we get those from bone marrow, as I indicated earlier. I do have some slides later as to show why we use bone marrow instead of fat, but the main reason is because bone marrow is where you have the most stem cells and the best stem cells to help to heal your problem. So what we're doing is we stick a needle down into the pelvic bone, and we pull out bone marrow. And I have a video showing me doing this to one of our patients, because this is the part of the procedure that most people get a little bit reluctant to hear about, because it sounds a little scary to get a needle stuck down into a bone and pull out bone marrow. We have done over 3,000 bone marrow aspirates in our practice, and I have personally done well over 1,000 of these. It is not a big deal. It is very well tolerated. So this is a video that I'm going to show you. It's actual turn. This is me doing a bone marrow aspirate procedure on one of my patients. First, I numb the skin. Then I'm looking under ultrasound, and I'm touching the bone. I'm injecting lidocaine. That whole syringe is filled with lidocaine, which is a numbing medication. So I'm basically making the bone entirely numb. I'm going in all different directions because we're going to hit different parts of the bone to make sure that that bone is nice and numb. Then I'm using a different needle, putting it in, and then I guide that needle down to the pelvic bone. I'm going to watch it under ultrasound, and I can see the needle in the back. I'm pushing it in. I see that I'm hitting the bone. I'm in the correct location. It's up against the bone. Everything looks good. So then the next thing I do is I drill onto that needle, and I go into the pelvic bone. Right now, that needle is in the pelvic bone. I pull out the stylet, I put a little bit of heparin in to make sure it doesn't clog. And then this is me pulling the bone marrow out, which you can see looks like blood. Very well tolerated. Patient isn't moving at all. They're fully awake during this part of the procedure. It is, all of you really feel is a little pinch and burn from numbing the skin, but pulling the bone marrow out, again, is very well tolerated. And I'm putting the needle back in and pulling it back out. So that's what's involved with so that's what, again, the second step is we're planting the seeds. This is a stem cell procedure. So we're taking the bone marrow from your back, then we take the bone marrow to our lab, which is right there in our office, and our lab technicians have to process bone marrow because bone marrow is about 95% other cells and only about 5% stem cells. We only want that 5%. It takes them about an hour and a half or so to process the bone marrow. During that time, our patients leave and go get breakfast or lunch, depending on what time of day they're there. And then they come back and we re-inject the stem cells on the same day into the exact location under X-ray or ultrasound guidance or both, depending on where we are placing our needles. So again, that's why it's a bigger day, because it's two parts. The first part, we need to do the bone marrow aspirate to get the bone marrow. Then we take the bone marrow to our lab, process it, and then re-inject the stem cells the same day. And again, that's why we call it a same-day stem cell injection. The third injection is usually done a few days later, and it's done with PRP. As I mentioned earlier, PRP acts like a stimulant or fertilizer to stem cells. So the analogy of the 3 steps is to till the soil with prolotherapy, plant the seeds, which is the bone marrow concentrate stem cells, and then fertilize the seeds with PRP. That's all done. The PRP, on that day, someone comes in, we draw their blood, we take it to the lab, they have to process it, we isolate the platelets, and then we re-inject it into the joint that we had just treated with the stem cells. So the first question, and the thing that's most important, is this safe? And the answer to that is absolutely safe. There is little to no risk involved with these procedures for a number of reasons. Number one, and most importantly, they are done guided under ultrasound or X-ray. As I mentioned, we do interventional orthopedics the correct way, meaning that we are watching our needles at all times to make sure they are in the correct location. The only real risk that one would have with a needle procedure would be an infection or bleeding. We have never had an infection, and we stop all blood thinners and monitor where we're sticking our needles to make sure we don't go near a blood vessel, so we've never had a bleeding complication. When you compare this to surgery, it's incomparable. Surgeries are done in hospitals. Bad things happen in hospitals. Infections take place. People can get nerve damage. They can get blood clots. God forbid, they can have worse problems like a heart attack or a stroke, or even dying from a surgical procedure. So again, we have published safety data that shows that this is an extremely safe procedure, because the first rule of medicine is do no harm. So next, I'm going to talk about the main 4 areas of the body that we treat with our regenerative procedures. We do, however, treat all joints and all painful areas. I'm just going to focus on the kind of the biggest, or the main 4 that we treat most often. So the first joint we're going to talk about is the knee. And the reason why I'm talking about this first is twofold. Number one, it's the most common joint that people develop osteoarthritis. And number two, it is the joint that responds best to stem cell treatment. Even if you have bone on bone, end stage, I need a knee replacement arthritis, you can undergo a stem cell procedure with our practice and expect to get about a 66% improvement in that condition. We have also looked at this for age and obesity, and neither of these are factors. In fact, I treated a 98-year-old gentleman with a stem cell procedure who did great and lived to be 104, almost pain-free with regards to his knee. So age is definitely not a factor. Obesity, sometimes a lot of patients are told by their surgeons that they're not a candidate for a knee replacement because they're Because of obesity, it's not a factor with us. We absolutely treat that problem and people have great results. So again, osteoarthritis of the knee is the #1 condition that we treat with the stem cells, mainly because it does so well. Other areas of the knee that we also treat are torn meniscus, and torn meniscus respond extremely well to regenerative treatments, whether that be stem cells or PRP. Often with the meniscal tear, you can treat that just with PRP. You don't need to do a stem cell procedure. We also treat torn ACLs, which is very common, especially in young athletes. As long as that tendon sheath is still intact, we can treat it with a stem cell procedure and totally repair the ACL tear. So this is a couple case examples. The first one is Pam, who's a 58-year-old aerobics instructor. She had 4 years of severe knee pain. She has grade 4 arthritis of her knee. Grade 4 is the worst. It goes from 1 to 4, so she has grade 4. She's the type of patient that a orthopedic surgeon says, you need a knee replacement. Her pain was 6 to 8 out of 10, and she wasn't working. She's an aerobics instructor. She received stem cell treatment with our practice, and within 3 months, her pain had gone down to a 1 out of 10, and she was back to exercise, back to teaching aerobics. She was doing yoga, she was doing Pilates and plyometrics, and she felt 85 to 90% better 3 months after treatment with us. And this is very typical of a patient that we see in our practice. This is 2 different MRIs of the same patient with an ACL tear. What I'm pointing to with my arrow is where the ACL should be. You can see that it's not a black line like the PCL is, but this is after a stem cell treatment. You can see that that black line has returned because the ACL has repaired itself after a stem cell treatment. Moving on to the next joint, and also probably the second most common joint we treat is the shoulder. And in the shoulder, we treat a number of different conditions, which I have listed on the left side. Rotator cuff tears respond extremely well to regenerative medicine. If it's just a small little partial tear, we can treat it with PRP. If it's a full thickness or partial thickness tear, we would use stem cells. As long as that tear is less than 1.5 centimeters retracted, people can get up to an 80% improvement with a stem cell treatment. And I have a slide of a rotator cuff tear in a second. Other conditions that we treat are labral tears, or also known as slap lesions. These respond very well to either PRP or stem cells. Also various tendon problems in the shoulder, biceps tendonitis, rotator cuff tendonitis, and lastly, osteoarthritis, both of the glenohumeral joint and the acromioclavicular joint. So arthritis of the shoulder also responds very well to stem cells. It might not be quite as robust as knees, but it does very well, unless it's really end stage and people have no motion. This is the MRI I was talking about of someone with a rotator cuff tear. This is a torn rotator cuff. All that white is fluid. The tendon is no longer intact. This is after the stem cell procedure, and the tendon is now intact and the fluid is no longer present. Moving on to the hip. This is the third most common joint we treat. Now, hips are a little more tricky than knees and shoulders because of the nature of the hip joint. If somebody has moderate or mild arthritis, they respond extremely well. But people with end-stage bone-on-bone arthritis, who are elderly and have contractures, generally are not a candidate. So the bottom line with hips is you have to be a little bit more careful in choosing the correct patient. But the correct patient does extremely well with a treatment in the hip. We also can treat a condition known as avascular necrosis of the hip, and this requires that we drill into the bone and place stem cells into the bone itself. As I mentioned, the same cells can help improve joints, it can help improve bones, it can help improve ligaments. So drilling that down into the bone can help an area of dead bone heal itself. Hip outcomes are very good. Again, choosing the right patient. That's why it's really important that you come to our office, that you see myself, you see Dr. Lieber, you see Dr. Sally. We do a thorough evaluation, and we tell you whether or not you're a good candidate for this procedure. But the good candidates, about 73% of Regenexx stem cell hip patients have returned to playing sports, golf, hiking, biking, skiing, running. This is an example, as I mentioned, of the needle going into the bony lesion for avascular necrosis. This is the hip bone up here. It's kind of showing it on two different angles going to the same area. So the fourth most common area that we treat is the spine. And spinal procedures have been revolutionary with regenerative medicine. So whether you have irritated or herniated discs, sciatica, facet-mediated pain, ligamentous pain, sacroiliitis, spinal stenosis, or even after surgery, we have good treatment options in our practice to help with spinal conditions. So instead of doing epidural injections with steroids, we use epidural and we use platelets, as I mentioned earlier, because platelets actually promote healing. This is an example of an epidural injection being done with platelets as opposed to steroids. Epidural steroid injections are extremely common. However, they don't last very long and they don't lead to any long-term benefit. This is a slide showing the difference between epidural steroid injections and epidural platelet injections. And by 3 months, the epidural steroid injection has worn off significantly. And by 6 months, they're basically gone, any effect that someone would have had with a steroid injection, whereas the platelet injections, people still have significant improvement over baseline. So briefly, I'm going to talk about how we compare to other people who are doing similar work in this field. Nobody is doing the same things that Regenexx does because nobody has Regenexx technology, nor do they have all of the research or the lab to back them up, nor do they adequately practice interventional orthopedics, meaning are they trained in how to place the needles into the correct area. So a lot of clinics, especially that started before the pandemic, started using amniotic fluid or cord blood from a pregnant woman. This has been tested, and there are no live stem cells in the amniotic tissue. It's really just baby urine, and there's no data to help support that this creates any success, as compared to what we use, which are real adult stem cells that can actually orchestrate a repair response. So buyer beware if you're going to go to a clinic that is using something that has no efficacy, no cells, and no proof that it actually works. Also, these are often done in a chiropractor's office, not done by a physician, often done either by a chiropractor, a nurse practitioner, a PA, which is a physician's assistant, but not by an MD or DO. They don't do them with guidance, meaning they blindly stick needles in and hope that they hit the correct location. Again, often done by a PA or nurse, and they can be very costly. The FDA is also now looking at these clinics, and also the FDA has come out against fat stem cells. The FDA has issued a cease and desist letter indicating that fat is actually a drug, and that's one of the reasons why we don't use fat in our practice for the source of stem cells. The other reason is this. It's that there's actually 10 to 20 times more stem cells in bone marrow per unit volume than there is in fat. So you're actually getting much better product from bone marrow stem cells than you do from fat stem cells. So head-to-head research heavily favors bone marrow over fat. You're getting a much better product. People ask, are my stem cells too old? The answer to that, I've already answered that earlier. No, Your body self-renews stem cells your entire life. Your stem cells, if you're 80 years old, are not the cells that you were born with 80 years ago. They're cells that your body made about 6 weeks ago. So they are not too old. So a lot of people, a lot of clinics are saying stem cells are too old, and this is absolutely untrue. We've had excellent results on patients in their 70s, 80s, and as I mentioned, in their 90s as well. So what's the downside? The downside is that most of this is not covered by insurance. Insurance does cover your consultation in our office. It does cover any follow-up visits. It covers any bracing or physical therapy that we would order. What it actually does not cover, however, is the procedure itself. However, when you compare surgery to a stem cell procedure and everything that's involved with deductibles, lost work, you actually will often end up paying more for a surgical procedure with your out-of-pocket minimums, again, time off of work, co-pays for therapy, lost wages, than you will with a stem cell procedure. So with stem cell procedures, depending, or with procedures in our office, depending on what we do, there is an out-of-pocket expense. There's a lot of range here. I'm not going to go into detail with this. This is something we would discuss with you or at your consultation and when you undergo treatment. So just to conclude my talk today, Regenexx isn't magic pixie dust. It is actually precise, safe, interventional orthopedics. We have been doing this longer than anyone else in the United States. We have more treatment options available than anyone else in the United States. We've published online data that is available to our patients. It's available to other physicians to do peer review, to understand that this isn't just something that we're talking about, that we're actually showing the research and sharing that data. And we use that data to help guide our decisions. So we change different procedures based on what the data tells us to do. So how do I get started? As I mentioned, the way to get started with this is to make a consultation to be seen in our office. You will see either myself, Dr. Lieber, or Dr. Sally in one of our office locations, and we will do a comprehensive evaluation for you. We will spend a lot of time with you going over what your problem is. We will look at your diagnostic studies. If you don't have any diagnostic studies done, we will order them for you, and we will give you an honest opinion as to whether or not any of our treatments would be of benefit to you. I see a lot of patients all the time that for one reason or another may not be a candidate, either because of a medical condition or because of what their problem is. It may not be something that we can actually treat. And if not, we may have some other options for you. We don't just do regenerative medicine in our practice. It's just what I'm talking about here tonight. So again, the easiest and best way of finding out if you are a candidate is to just make an appointment. We take every insurance in the Pittsburgh area at our practice. We will bill this just like you would see any other physician. So there's no, and it's billed to your insurance. And then you can decide whether or not you're a candidate and whether or not we think you're a candidate. And again, we will give you an honest opinion. That's the number one thing I can promise you. So again, please call us at our office to schedule an appointment. Our phone number is 412-963-6480, and we can get you scheduled to see one of us and let you know what we think. So now I'll open up for questions. I want to thank everybody for joining me tonight. I exit my screen and put myself back up here. So if people have any questions, there's a Q&A box in the Zoom call. Please put your questions in there and I'll be happy to answer your questions and go from there. First question, can I get both knees done at the same time? The answer to that one is no. And the reason why the answer is no is because when we do the bone marrow aspiration and we take out your bone marrow, if we put half of it in one knee and half in another knee, each knee is only getting a half a treatment. So what we do for people with two bad knees is we'll do the more involved knee first, and then usually 3 to 6 months later, we'll bring you back to do the other knee. So you're definitely a candidate for both knees. And again, we only do these one knee at a time. Okay, next question is, how long did the results generally last? That's a great question. And we still don't really know the answer to that question because this is still an evolving science. But we do have a lot of data now. We've been doing this, as I mentioned, we're just starting our 12th year here. Regenexx published 5-year data, which came out about 1.5 years ago, that showed that people who got better at 6 months were still good at 5 years, 95% of those patients. So very few people dropped off after 5 years. We don't have 10-year data yet because we don't have enough patients that have hit that 10-year mark. But I have seen a lot of people in the practice that are now 7, 8, 9 years out and are still doing well. And you can always get a repeat procedure down the road if necessary. You can also get a different body part done down the road if necessary. As I mentioned, your body will renew all of the bone marrow that we take out when we do this. So if you come to see us first for a bad knee and we treat your knee and you're feeling better, and then you hurt your neck or you hurt your shoulder or another body part, absolutely, it's something that we can treat down the road. Next question, does this work for spondylitis grade 3 to 4? I'm assuming you mean spondylolisthesis, which is a slippage of the vertebrae of the spine. So the answer to that is it depends. We'd have to see your x-rays. For some people, certainly grade 3, we can absolutely treat. Grade 4 is a little bit more difficult, but if you were told by a surgeon that you're not a candidate, we absolutely could consider doing treatment. So I don't have the 100% answer for every patient because everyone's different. You need to look at dynamic x-rays, meaning flexion and extension, to see how much movement there is. But it's certainly worth coming in and having us take a look at. Will interventional orthopedics work for rotator cuff tear? The answer to that is absolutely yes. We've treated hundreds and hundreds of rotator cuff tears. They've worked extremely well. What would typical recovery be? It's nothing like surgery. Surgery for rotator cuff tear is often 3 to 6 months. The first 3 months are awful. People are in severe pain. They can't sleep at night. They have to sleep in a chair. Several months of long recovery, and it takes really 6 months to get back. Whereas recovery, if you have a procedure with us for a rotator cuff tear, you're back to baseline within a week, and you're generally noticing improvement by 2 to 3 weeks, but you don't have to take any time off. So you're basically doing everything that you were doing prior to the treatment within a week. So there is no downtime with the rotator cuff procedure. It may take 3 to 4 months before you know full improvement, 100%, but there's not the downtime that you get when comparing it to surgery. What percentage of people do you not see results in? Well, that's a very good question. Generally, it's very rare to have 0 improvement from one of these procedures. We're pretty good. Again, we've been doing this, going on 12 years now, and I think we're pretty good at determining who's a good candidate and who isn't. So if, early on when we first started doing this, we did, I would say we probably had 10% of patients who didn't do very well with it. I think that percentage now is probably down to 2 or 3% that have no improvement whatsoever. Now, some people, may not get 70, 80% improvement. Some people may get 40, 50%. But the chance of you getting no improvement is extremely unlikely. The one thing also keep in mind is this requires a motivated patient. It requires people that want to go to therapy, that want to exercise, because the treatment is going to help the joint to get better, but then you need to exercise. You need to lift the weights. You need to do the bands for the shoulder. I'm showing that because you can see me. But the same is true for the knee, for the back. It does require that you put some effort in, and that will also help to your road to recovery. What's the timeline for knee stem cell recovery? Again, very similar to what I just mentioned for shoulder. After you get the stem cell treatment, you're back to your baseline, and where you were right before the procedure, usually in 3 to 4 days. We do get you fitted with a knee brace for the first couple of weeks. During that time, you go to physical therapy, but it's a walking brace. It's something that you can exercise in, that you can walk and do. So again, within a month, people are doing aggressive exercise. That's when our athletes are going back to playing sports. Our runners are running within a month. People playing basketball, tennis. We treat a lot of athletes, and these are people that want to get back to higher level athletics. So within a month, you're back to doing all your exercises, and but the full improvement may take 3 to 6 months before people feel the maximal benefit from the procedures. Okay. Are there any other questions that people have? I'd be happy to answer those. I'm not seeing anything else come up. So I will conclude tonight's webinar, and I want to say, first and foremost, thank everybody for joining me. Again, this is being recorded. The recording is available right on our website. So in case you came in a little late or missed some of this or have additional questions, that will be there. But really the best way to get your questions answered is just come see us in the office. I mean, that's my number one message tonight. I can't answer all of your individual questions because we treat everybody as an individual, and we will give you an honest opinion as to whether or not these procedures are right for you. So once again, I want to thank everybody for joining me tonight, and have a pleasant evening.